Here's a number I want you to think about for just a moment. 1 in 3. 1 in 3 Americans over the age of 60 will die from cardiovascular disease. Not cancer, not diabetes, heart disease. And the tragedy, the real tragedy, is that for millions of people, the damage happening inside their arteries right now is completely silent. No chest pain, no warning, just slowly narrowing vessels, rising blood pressure, and a heart working harder every single day just to keep up. I'm Dr. Leonid Kim. I've been a practicing cardiologist for over 22 years, and I created this channel, Senior Health Review, for one reason: to give adults over 60 the straightforward, science-backed information your doctor wishes they had more time to share with you during a 15-minute appointment. Today I'm going to walk you through 4 specific nuts, yes, ordinary nuts you can buy at any grocery store, that clinical research has shown to help reduce arterial plaque, lower LDL cholesterol, and bring blood pressure down naturally. Now, before you click away thinking this sounds too simple, I want you to stay with me, because the science here is not flimsy. We're talking peer-reviewed studies published in journals like the New England Journal of Medicine, the American Journal of Clinical Nutrition, and research funded by the National Institutes of Health. And I'll tell you right now, nut number 2 on this list is the one most people completely overlook. It might be the most underrated cardiovascular food in existence, so make sure you're watching until at least that point. Let's get into it. Before we talk about the solution, let's spend just 2 minutes making sure we're on the same page about the problem, because understanding why this happens is what makes the solution so satisfying. Your arteries are not rigid pipes. When you're young and healthy, they're flexible, smooth on the inside, and they expand and contract with every heartbeat. But over decades, especially after 60, several things start working against you. First, the inner lining of your arteries, called the endothelium, becomes more vulnerable to damage from things like oxidized LDL cholesterol, chronic inflammation, and elevated blood pressure. When that inner lining gets damaged, your body sends in a repair crew, white blood cells, fatty deposits, calcium, to patch it up. Over time, that patch becomes what we call plaque. As plaque builds up, your arteries narrow. The heart has to pump harder to push blood through a smaller opening. Blood pressure rises, and if a piece of that plaque breaks off, that's a heart attack or a stroke. Now, I want to be very clear. I am not here to tell you to throw away your medications. If your doctor has prescribed statins, blood pressure medication, or blood thinners, those are there for a reason, and you should continue working with your physician. What I am here to tell you is this: food is one of the most powerful tools we have for prevention and support. A landmark study, the PREDIMED trial, involving over 7,000 participants, found that a Mediterranean-style diet rich in nuts reduced the risk of major cardiovascular events by 30%. 30%. That is not a rounding error. All right, let's talk about the 4 nuts. The first nut on our list is the walnut. I always say, if nature designed a food to look like what it helps, walnuts nailed it. They look like a tiny brain, and as it turns out, they're exceptional for both your brain and your heart. Here's why walnuts are special, particularly for arterial health. Walnuts are the richest plant-based source of alpha-linolenic acid, ALA, which is a type of omega-3 fatty acid. Now, you've probably heard about omega-3s in the context of fish oil. The mechanism is similar. Omega-3 fatty acids help reduce systemic inflammation, and inflammation, as we now understand, is one of the primary drivers of arterial plaque formation. But it goes deeper than that. Walnuts also contain L-arginine, an amino acid that helps your body produce nitric oxide. Nitric oxide is your artery's best friend. It signals the smooth muscle in your artery walls to relax and dilate, which directly lowers blood pressure and reduces the mechanical stress on those vessel walls. Now let me give you some of the science behind this. The Penn State Walnut Study, published in the Journal of the American Heart Association, followed adults with mildly elevated cholesterol. Participants who ate walnuts daily for 2 years showed significant reductions in LDL cholesterol. And here's the part I love. They also showed measurable reductions in central diastolic blood pressure. That's the pressure in your main artery, the aorta. Lower central pressure means less strain on your heart with every single beat. Additionally, the Predimed study I mentioned earlier specifically identified walnuts as one of the key protective nuts in the Mediterranean diet cohort. How much should you eat? 1 ounce per day. That's about 7 walnut halves. You can eat them raw, lightly toasted. Just avoid heavily salted or flavored versions. A practical tip for those of you over 60. Add your daily walnuts to your morning oatmeal. The combination of oat beta-glucan and walnut omega-3s creates a genuinely powerful cardiovascular 1-2 punch to start your day. One more thing. If you're on a statin medication, walnuts work synergistically with statins. They don't interfere. They support the same goal. The second nut, and the one I said most people overlook, is the almond. Now, I know what you might be thinking. Dr. Kim, almonds? That's not a secret. And you're right, almonds are everywhere. But here's what most people don't realize. The specific mechanism by which almonds protect arteries is something very few people understand, even people who eat them every day. Here's the key. Almonds are extraordinarily rich in vitamin E, specifically the alpha-tocopherol form. And vitamin E is not just a general antioxidant. It has a very specific job inside your cardiovascular system. When LDL cholesterol, the bad cholesterol, gets oxidized by free radicals, it becomes dramatically more dangerous. Oxidized LDL is what your immune system attacks, what gets embedded in artery walls, and what triggers the inflammatory cascade that leads to plaque. Vitamin E essentially acts as a protective shield around LDL particles, preventing that oxidation from happening in the first place. Think of it this way. LDL without vitamin E protection is like a brand new car left out in the rain without a coat of paint. It rusts, it corrodes, it causes damage. Vitamin E is that protective coating. A landmark study published in the New England Journal of Medicine involving over 87,000 female nurses found that women with the highest vitamin E intake had a 41% lower risk of major coronary disease. And a 2002 study in the Journal of Nutrition specifically looked at almonds and found that daily almond consumption reduced both LDL cholesterol and markers of oxidative stress in participants with elevated cholesterol. Beyond vitamin E, almonds also contain flavonoids, plant compounds found in the brown skin of the almond that work alongside vitamin E to further protect the vessel lining. This is why you want to eat almonds with the skin on. Blanched almonds lose a significant portion of this benefit. How much? 23 almonds, about 1 ounce. Eat them raw. If you prefer roasted, go for dry roasted with no added salt, especially if you're managing hypertension. A practical swap I recommend to my patients: replace the mayonnaise on your sandwich with almond butter. You eliminate the inflammatory seed oils and hydrogenated fats in mayo and replace them with heart-protective vitamin E and monounsaturated fats. Simple change, real impact. And one caution: if you have a tree nut allergy, obviously almonds are off the table. Please speak with your allergist before making any changes. Number 3 on our list is the pistachio, And this is the nut I call the blood pressure specialist. If you are specifically dealing with high blood pressure, and statistically about 70% of Americans over 65 are, then pistachios deserve a special place in your diet. Because pistachio is the only nut that has been shown in clinical trials to lower both systolic blood pressure and total cholesterol simultaneously. Let me explain why. Pistachios contain a compound called lutein, which most people associate with eye health, and it is excellent for your eyes. But lutein also functions as an anti-inflammatory agent inside artery walls. When arterial walls are inflamed, they stiffen. Stiff arteries cannot expand and contract properly, which forces the heart to pump against greater resistance, causing blood pressure to rise. Lutein helps reduce that inflammation. But here's what really separates pistachios: their arginine content. We talked about arginine briefly with walnuts, but pistachios have an exceptionally high arginine to calorie ratio. Arginine leads to nitric oxide, leads to arterial relaxation, leads to lower blood pressure. That pathway is well established in cardiovascular medicine. Now let's look at the research. A 2015 study from Penn State University, published in the Journal of the American Heart Association, placed participants with mildly elevated cholesterol on diets containing 1 or 2 servings of pistachios per day. The group eating 2 servings showed a significant reduction in systolic blood pressure, the top number. They also showed reduced arterial stiffness, measured objectively using a technique called pulse wave velocity. Lower arterial stiffness means your heart is under less strain with every beat. And here's a bonus I love about pistachios for my patients over 60 who are also managing their weight. Pistachios have the fewest calories of any nut we're discussing today. 1 ounce contains about 159 calories, compared to 185 in walnuts or 170 in almonds. My specific recommendation? Buy pistachios in the shell. Research has actually shown that people who eat in-shell pistachios consume about 40% fewer calories, because the act of shelling each nut slows you down. You eat more mindfully. You feel full faster. It's portion control built into the food itself. Add them to your morning oatmeal, sprinkle them on a salad, or just keep a small bowl on your kitchen table as a go-to snack. Replace your afternoon crackers or chips with a small handful of pistachios, and your heart will thank you within weeks. And now we come to nut number 4, the one that surprises almost everyone, the Brazil nut. I want to start with the most important thing I'm going to say about this nut, and I want you to really hear this. You only need 2 Brazil nuts per day. 2. Not a handful, not a small bowl, just 2. I'll explain why in a moment, but first, let me tell you what makes the Brazil nut so extraordinary that 2 of them per day is genuinely enough to make a cardiovascular difference. Brazil nuts are the single richest dietary source of selenium on the planet. 1 Brazil nut contains somewhere between 70 and 90 micrograms of selenium. The daily recommended intake for adults is 55 micrograms. So 2 nuts gets you well above that, which is exactly where you want to be for cardiovascular benefit, but not so far above that it becomes harmful. Now, why does selenium matter for your arteries? Selenium is the essential cofactor for an enzyme your body produces called glutathione peroxidase. This enzyme is one of your body's most powerful internal antioxidants, and it specifically works inside artery walls to prevent the oxidation of LDL cholesterol. Remember how we talked about oxidized LDL being the trigger for plaque formation? Glutathione peroxidase is your body's built-in defense against exactly that process. When selenium levels are low, which they often are in older adults because selenium absorption decreases with age, this enzyme system becomes less effective. Plaque formation accelerates. Inflammation in artery walls increases. Research published in the European Journal of Nutrition found that participants with higher selenium status showed significantly lower levels of oxidized LDL and lower markers of cardiovascular inflammation. A separate analysis of data from the National Health and Nutrition Examination Survey found that people in the lowest selenium quartile had substantially higher rates of cardiovascular mortality. Now, why only 2? Selenium is what scientists call an essential trace mineral, meaning you need it, but the therapeutic window is narrow. Consuming more than 400 micrograms per day consistently can lead to selenium toxicity, or selenosis. Symptoms include hair loss, nail brittleness, nerve damage, and gastrointestinal problems. If you are already taking a multivitamin or a selenium supplement, check the label before adding Brazil nuts. You may already be meeting your selenium needs, and you don't want to stack on top of that. My recommendation? Eat 2 Brazil nuts with breakfast. That's it. Make it a daily ritual. Simple, consistent, genuinely powerful. Before we go any further, I need to spend a few minutes on something critically important, because I see this mistake constantly, even among people who are genuinely trying to eat well. The form in which you eat these nuts matters enormously. Here is what you need to avoid. Honey roasted nuts. The added sugars trigger insulin spikes and inflammation, which is exactly the opposite of what we're trying to achieve. The honey coating also masks how many you're actually eating. Heavily salted nuts. If you're managing blood pressure, and remember, 70% of people over 65 are, a bag of salted mixed nuts can easily contain 400 to 500 milligrams of sodium per serving. That erases the blood pressure benefit entirely. Chocolate-covered or candied nuts. I shouldn't have to say this, but I do, because these products are marketed alongside healthy nuts in stores. The saturated fat and sugar content in these products makes them heart-unfriendly, regardless of the nut inside. Dry roasted is generally fine. Light roasting does not significantly degrade the beneficial compounds in most nuts. The problem is the added ingredients: salt, sugar, oils, flavor coatings. A word on medication interactions. If you are on warfarin or other blood thinners, please speak with your doctor before significantly increasing your nut intake. Some nuts, particularly walnuts, contain vitamin K, which can interact with warfarin's mechanism. If you have a tree nut allergy, work with your allergist. Some people allergic to one tree nut can tolerate others, but this must be evaluated individually. And if you have a kidney condition, be aware that Brazil nuts are relatively high in phosphorus. Again, your nephrologist is your best guide here. Now that we've covered all 4, let me show you how to put this into a simple, practical daily habit. I call it the Senior Heart Protocol, and I genuinely recommend this to patients in my practice. Here's what a simple daily routine looks like. Morning, with breakfast, 2 Brazil nuts, selenium activation, start your day. 7 walnut halves on your oatmeal, omega-3 nitric oxide support. Midday, as an afternoon snack instead of crackers or chips, 23 almonds, raw or dry roasted, unsalted, vitamin E, LDL oxidation protection. Evening, with your salad or as a pre-dinner snack, a small handful of in-shell pistachios, about 20 to 25 kernels, blood pressure support, arterial flexibility. Total cost? Roughly 80 cents to $1.20 per day, depending on where you shop. Less than a cup of coffee. Now, I want to address something directly because I know some of you are thinking it. Dr. Kim, how does this compare to just taking a statin? It's not an either-or question. Statins are powerful medications that lower LDL production in the liver. Nuts work through different mechanisms, reducing inflammation, preventing LDL oxidation, improving nitric oxide availability, and supporting the body's antioxidant defense systems. These approaches are complementary, not competing. What I can say is this: the research on dietary patterns, particularly the PREDIMED trial, shows that a nut-rich Mediterranean diet provides cardiovascular protection that goes beyond what cholesterol numbers alone can predict. That's because cardiovascular disease is about more than just LDL. It's about inflammation. It's about oxidative stress. It's about vascular function. And nuts address all of those factors. This is not a replacement for your medication. This is not a cure. It is a powerful, evidence-based addition to a heart-healthy lifestyle. And at your age, every tool in that toolkit matters. All right, let's bring it home. Here's your quick recap. Walnut, 1 ounce daily, the omega-3 powerhouse, reduces LDL, lowers central blood pressure, fights inflammation. Almond, 23 per day, the artery cleaner, shields LDL from oxidation with vitamin E, protects endothelial cells with flavonoids. Pistachio, 1.5 ounces per day, in the shell. The blood pressure specialist, lowers both systolic BP and cholesterol through arginine and lutein. Brazil nut, just 2 per day, the selenium activator, supercharges your body's own antioxidant enzymes to prevent plaque formation at the cellular level. Here's what I personally eat every morning: 2 Brazil nuts and a small handful of walnuts with Greek yogurt. That's been part of my routine for over 10 years. Not because I tell patients to do it, but because the science convinced me to do it myself. Now, I have a favor to ask. If you learned something new today, something that might genuinely help your heart, please give this video a thumbs up. It takes 2 seconds and it helps this information reach other seniors who need it. And if you haven't subscribed to Senior Health Review yet, please do that now and hit the notification bell. I publish new videos every week, and every single one is designed specifically for adults over 60, backed by real science, explained in plain English, with practical steps you can actually use. I read every comment, so tell me, which nut are you going to start with? Drop it below, I'd love to know. And if you enjoyed this video, the next one you should watch is right up here. It's called 5 Foods That Actively Destroy Arterial Plaque. And one of them is something almost everyone throws away. I'll see you there. Take care of that heart. It's the only one you've got. I'm Dr. Leonid Kim. This is Senior Health Review.